Hey everyone, welcome back. We're going to be doing a deep dive today on something that's pretty surprising and also concerning,
Yeah.
and that is the increase in mortality rates
Yeah.
among middle-aged white Americans.
Yeah, it's really interesting when you compare the trends in the US to what's happening in other developed countries.
Right.
You see this really stark difference in how things are playing out.
Yeah, and it is pretty striking that while most developed countries are continuing to see improvements in health and life expectancy,
Yeah.
the U.S. has kind of experienced a reversal of these trends
Yeah.
for this specific group.
Right.
So, it's a real anomaly.
Absolutely. And the study that really brought this issue to light was published back in 2015 by Ann Case and Angus Deaton,
Yeah.
and it's become a really landmark piece of research in this area.
Yeah.
What was so striking about their work was this stark contrast they highlighted. Between 1978 and 1998,
Okay.
mortality rates for white non-Hispanics aged 45 to 54 were falling by about 2% per year,
Wow.
which is a substantial decrease.
Yeah.
And it really suggested that things were moving in the right direction.
Right.
But then after 1998, this trend just abruptly reversed.
So instead of continuing to decline,
Yeah.
mortality rates for this group actually started to climb,
Right.
increasing by about 0.5% each year.
That's right.
And the impact of this shift is really huge. Case and Deaton estimated that almost 100,000 deaths could have been avoided between 1999 and 2013
Wow.
if mortality rates had just stayed at their 1998 levels.
That's a staggering number. It really underscores the seriousness of this issue.
Yeah, it really is.
And to make things even more complicated, this reversal wasn't seen across all demographic groups.
Yeah, that's what I was wondering.
It was specific to middle-aged white non-Hispanics.
Okay.
Other groups continued to see a decrease in mortality rates during this period.
So it makes you wonder, right? Like, what are the factors that are really impacting this population?
Right. What's going on here? What makes this group so different? It's really a puzzle.
It is. So let's get into some specifics then.
Okay.
What were the primary causes of death that were really driving this increase in mortality?
So the study identified three main culprits: suicide, drug and alcohol poisoning, and chronic liver disease.
Wow.
And what's interesting is that while each of these issues on their own was kind of already on the radar of public health experts,
Right.
Case and Deaton's work really revealed this kind of alarming fact that together these three factors
Okay.
were actually driving the overall increase in midlife mortality for this group.
So it wasn't just a single factor, but it's really the combination of these causes.
Exactly. They were all intertwined and kind of created this perfect storm.
Oh, wow.
To give you a sense of just how significant this was, by 2011, poisoning primarily driven by drug overdoses
Okay.
had actually surpassed lung cancer as a leading cause of death for this age group.
Wow, that's a really stark statistic.
Yeah.
It really kind of just paints a picture of how widespread this problem actually became.
Absolutely.
And I understand that education level also played a role in these trends.
That's right. The study found that those with a high school degree or less actually saw the most dramatic increase in mortality.
Oh, wow.
And within that group, the death rate from poisoning was 4 times higher than it was in 1999.
Oh, my goodness.
So we see this very clear disparity in how this crisis impacted different segments of the population.
Right.
It wasn't just a monolithic experience.
So it wasn't just about mortality rates either.
Yeah.
There was also a corresponding increase in morbidity
Yes.
during the same time period.
You're absolutely right. The rise in mortality wasn't happening in a vacuum. It was happening alongside this really significant increase in a whole range of health problems.
Yeah.
When you dig into the data that Case and Deaton presented in their study, specifically Table 2,
Yeah.
it's pretty striking. You see these significant increases in self-reported fair or poor health,
Right.
both physical and mental.
Yeah.
Chronic pain was a major issue, with increases in things like neck pain, facial pain, joint pain, and sciatica.
Yeah, it sounds like everyday life just became a real struggle for a lot
Absolutely.
of these people.
Yeah, and the study also showed a significant increase in reports of difficulty with activities of daily living,
Oh, wow.
like walking, climbing stairs, even socializing.
It's like basic stuff.
Yeah, these weren't just minor inconveniences, you know?
Right.
The impact was really substantial, and it also extended to people's ability to work.
Yeah, I was going to ask about that.
The number of individuals reporting they were unable to work actually doubled during this period.
Wow.
So, we're not just talking about an individual health crisis here, but potentially an economic one as well.
Right. So are there any connections between these findings and kind of these broader economic trends that were happening at the same time?
Yeah, there are some really interesting parallels. For instance, we saw this significant rise in disability claims during this period
Okay.
and a decline in labor force participation, particularly among this demographic.
So we've established a pretty bleak picture here.
Yeah.
Rising mortality and morbidity rates
Hmm.
driven by this complex kind of interplay of factors and potentially linked to economic challenges as well.
Right.
So what I'm really curious about now is what's at the root of all of this? What are the underlying causes of this alarming trend?
Well, it's a really multifaceted issue, a perfect storm of sorts, but the opioid crisis undoubtedly played a significant role.
Yeah.
Beginning in the late 1990s, there was this massive increase in the availability of prescription painkillers.
Right. And then as those became more difficult to obtain,
Yeah.
a lot of people turned to heroin, which
It's like-
tragically became more readily available and cheaper,
Right.
even in communities where it hadn't previously been a significant issue.
Exactly. It was this kind of 1-2 punch that had a devastating impact.
Yeah.
And all of this was coinciding with this growing epidemic of chronic pain.
Right.
The very condition that these opioids were often prescribed to treat in the first place.
It's like a heartbreaking paradox that's going on.
Absolutely.
So while the opioid crisis certainly holds a prominent place in this story,
Yeah.
it feels like there's got to be more to it.
Yeah.
What other factors could be contributing to this crisis?
You're right. It's really important to look beyond just that immediate crisis and consider the broader context.
All right.
Economic factors, for example, seem to have played a significant role.
Mm.
The baby boomer generation, the one that's most affected by these trends, was hit really hard by stagnant wages,
Right.
rising income inequality, and a general lack of financial security compared to previous generations.
It must have felt like such a betrayal of the American dream.
Absolutely.
For a generation that was raised with this expectation of upward mobility and a secure future.
Exactly. And, compounding all of this was a shift in the U.S. from defined benefit pension plans to defined contribution plans,
Right.
like 401k.
Yeah.
To clarify, defined benefit plans guarantee a specific monthly payment in retirement based on your years of service and salary.
Right.
So it provides a certain level of predictability.
Right.
There's defined contribution plans
Yeah.
depend on individual contributions and investment performance.
So there's more risk involved.
Exactly. There's this element of risk and uncertainty that's introduced. So basically, this shift added another layer of financial insecurity for many people,
Right.
leaving them more vulnerable to things like economic downturns and market fluctuations.
And so retirement, which was once seen as this time of, relaxation and well-being,
Yeah.
became a source of stress and anxiety for a lot of folks.
Right.
So we've got this really complex web of factors here.
Yeah.
The opioid crisis, rising chronic pain,
Right.
economic insecurity, the changing retirement landscapes.
It's a lot to grapple with.
It really is.
Yeah.
What I'm wondering is, while these issues were also present in other developed countries,
Yeah.
why didn't we see these same mortality and morbidity trends there?
Mhm.
What makes the U.S. experience so unique?
That's a really crucial question, and researchers are still working to fully understand all the nuances. But there are some potential explanations out there.
Okay, let's dive into those in part 3.
Okay. So let's dive into those potential explanations. Why didn't we see these same trends in other developed countries?
Well, one key difference might be in how our healthcare system is structured in the U.S.
Mm.
The U.S. is the only developed country that doesn't have universal healthcare coverage.
Right.
So that means access to things like healthcare, including mental health and addiction treatment, are often tied to your job
Okay.
and can be super expensive.
So if someone's facing job loss or financial hardship,
Right.
they might be more likely to lose their health insurance,
Exactly.
making it even harder to seek help for these very issues that are contributing to these increases.
It's a vicious cycle.
Yeah.
And on top of that, the U.S. healthcare system is really fragmented with this complex web of providers and insurers.
Right.
And that can make it really tough to navigate and potentially delay treatment.
That definitely makes sense. We've talked a lot about the challenges and these pretty grim statistics.
But what can be done?
Yeah.
Where do we go from here? How do we address this?
That's the million-dollar question,
Right.
and there's no easy answer.
Of course.
It requires a really comprehensive approach that tackles both those immediate symptoms and the root causes.
So let's start with the immediate stuff. What can we do right now to address the opioid crisis and the rise in deaths from drug poisoning?
Well, we definitely need a multi-pronged strategy here
Okay.
that includes things like stricter prescribing guidelines for those opioid painkillers,
Right.
expanded access to evidence-based treatment for addiction,
Okay.
and harm reduction strategies like making naloxone more widely available to prevent fatal overdoses.
And it sounds like addressing that chronic pain epidemic is also really important.
Oh, absolutely.
So what approaches could be effective there?
Well, I think we need to move beyond just masking the pain with medication
Okay.
and explore some more holistic and preventative measures,
So things like what?
like investing in physical therapy, promoting things like acupuncture or massage. And we can't forget about the mental health component.
That's right.
So therapy and support groups could be really helpful.
And it seems like we need to address those economic factors at play here too.
Absolutely.
So what kind of policies could create a more secure and hopeful future for this generation?
Well, we need policies that focus on creating jobs,
Okay.
that ensure people are earning livable wages, and that expand access to affordable housing.
Right.
Strengthening the social safety net is super important too,
No thing
like providing more support for those struggling with unemployment disability or retirement insecurity.
Yeah, it's a tall order for sure.
Yeah,
But it feels like we can't afford to just sit back and ignore this.
right.
What happens if we do nothing?
I mean, the consequences could be really significant. We could see these trends continue, more increases in mortality and morbidity, further strain on our healthcare system,
Wow.
a decline in economic productivity because more people are unable to work. But honestly, even beyond the numbers, what's really at stake here is losing an entire generation to despair and hopelessness.
Yeah, that's a powerful point.
Yeah.
This has been a really tough but important conversation.
Yeah, it has.
So for our listeners out there, what are some things they can do, even in their own lives, to start making a difference?
Well, I think it starts with awareness. Talk to your friends and family about this.
Okay.
Support organizations that are working to address things like addiction, chronic pain, and economic hardship, and advocate for policies that promote a more just and equitable society.
So even small actions can really contribute to a larger movement for change.
Exactly.
Well, this deep dive has been a really eye-opening experience, and I want to thank you for joining me for this conversation.
Thanks for having me.
And to all of our listeners out there, we'll leave you with this. What does this research really tell us about the state of our society, and what role can each of us play in building a better future for all generations?